Good morning and welcome to Quest for Quality, the podcast of the IPRO Quality Innovation Quality Improvement Organization, or QIN-QIO. I'm Terry Lebowski and I'll be your host for today. In late 2022, the White House announced a 6-week campaign to encourage Americans to get their updated COVID-19 boosters. The goal was to prevent thousands of COVID-related deaths by decreasing transmission ahead of the holiday season. Across the nation, QIN-QIOs were asked to focus on nursing homes and long-term care facilities to ensure that our most vulnerable populations would be protected. Today, it's my privilege to have a conversation with Dr. Stacy Gugino, Medical Director at Brothers of Mercy Skilled Nursing Facility and Garden Gate Skilled Nursing Facility, as well as Tennyson Assisted Living in Buffalo, New York. Dr. Gugino is one of the partners of the Highgate Medical Group, which is the oldest primary care group in her area and the medical home for over 30,000 patients. In her private practice, Dr. Gugino has developed a subspecialty in geriatric medicine. Dr. Gugino graduated from the University of Buffalo School of Medicine and Biomedical Sciences as a Doctor of Medicine in 2012. She completed her family medicine residency at the University of Buffalo Millard Fillmore Suburban Hospital. Hello, Dr. Gugino. I'm so happy to be talking with you today about the COVID bivalent vaccine in the nursing home setting.
Hi, thank you for having me.
Maybe we can start off with your current COVID vaccination rate with the bivalent vaccine.
Right. Yes. Currently, we're at 75% for our residents and only 22% for our staffs for the bivalent vaccine. Now, this is a significant reduction that I think all facilities are seeing. And in the beginning, we were at 99% for primary vaccination for residents and 99.5% for our staff. So this is we want to see this higher, and we're trying to incentivize both residents and staff. It has been easier to encourage residents versus the staff this time, but definitely a significant reduction from what we saw with the primary vaccine series.
So what sort of questions are you hearing from residents and from staff about the bivalent vaccine, and how are you addressing some of those?
Yeah, I think the residents, the number one question I hear is, do you think I should get the vaccine? I would say that the most important way our staff in these facilities can help to encourage vaccination for these vulnerable, high-risk patients is to encourage, stay confident, and stay positive about the vaccine. Even if some of these younger staff members are choosing not to vaccinate themselves, which I don't agree with, but they have to have an understanding of the protection that this provides for this highest risk population. And they need to do their part to help encourage, even if it goes against some of their own beliefs, because these residents, they trust the staff taking care of them. Almost 100% of the time, I would say a resident would follow the direction of the staff or the caregiver or the doctor or the nurse giving them advice. So that's the number one question I get is, do you think I should get the vaccine? So if you take the time, which time, everyone's busy, everyone has a lot to do on their list, but if you take the time to have that discussion with these residents, it goes a long way. They really appreciate it. And sometimes they just appreciate that discussion, and that's all they need. They want to hear it. The news gives scary information. It's hard to follow in the newspapers. And there's a lot of positivity, but there's a lot of criticism and negativity about the vaccine too. And they just want a medical professional to really kind of help them understand the positives and any potential negatives for them. As far as staff asking questions, staff have been tougher, like I said, this time around. The primary vaccination, we had the New York State mandate in place. So they didn't, if they wanted to keep their job in the facility caring for residents, it was a mandate. And that did help us in some way. Unfortunately, we still lost quite a few staff, but that did help. Now, this time around, you hear the younger staff say, well, what's different? Or I had COVID and I was okay. Or I've already been vaccinated, or I'll just see if I'll see if I get the disease. And I like to address the what's different, because sometimes people don't understand that this vaccine, this new bivalent vaccine, offers that additional protection. We have coverage now for these two most common circulating, highly infectious strains that we didn't have coverage for with that primary vaccination. So again, sometimes it's just taking the time to explain what we're doing with this vaccine, how this one is different. And then beyond that, with staff, trying to get through to them that protection that it provides beyond themselves, but the protection for the population that they're caring for, or the protection if they want to visit an elderly family member or a sick family member. And that's been the best way that I've been able to get through to staff, is to talk about, you're not doing it for you at this point. You are, because I still think it will help you. But in your mind, think about how you're protecting. You chose to work in medicine. If you're in this building, working in this facility, you have a desire to help others. And you truly, this is one of the best ways you can help the residents that you're taking care of, is to prevent that virus from coming into our building and spreading. We've all seen how quick when the virus is there, how quick it spreads. We've seen devastation, especially early on, but even recently. The virus is unpredictable. We don't know who it's going to affect most. We can risk stratify and have an idea, but sometimes it's still affecting people with bad outcomes that we did not anticipate. So sometimes using those anecdotal stories with our staff has been very helpful too. But it really is a discussion point for both the residents and the staff. Take the time, educate, and answer their questions, because what you find in social media is not always the best answer, and they need someone that they can trust to have that discussion with.
How do you handle vaccinating a resident after they have had an active case of COVID? And what are some of the points that you include in your risk-benefit assessment?
More recently, as we all know, the CDC has updated their guidance that after an infection with COVID, you can wait to be vaccinated for 3 months. Now, this is new. This is not, a year ago, we were not doing that. A year ago, as soon as that patient was recovered, asymptomatic, and afebrile, we were vaccinating. Now, for our low-risk population, specifically outpatients that I see not in these facilities, I am following the CDC guidance. I think there's an additional level of immunity building that's able to be done if you wait, like the CDC has said, for the 3-month interval. But that's not always true in the acute, inpatient, long-term, high-risk population. So that's where we really take each resident case by case. And I would say 9 out of 10 times we are not waiting that 3-month interval when a patient is in a skilled care facility. We are vaccinating at the earliest opportunity we can, because that's a high-risk population. There's potential to spread to others. And I don't want to miss an opportunity. So usually for these inpatients, we wait a 2-week interval to consider that they're recovered, and then we offer that vaccination. Again, that's not what I'm doing in the outpatient setting. Outpatient setting, I'm certainly following the CDC guidance, except for the highest risk population. But in the inpatient, I think there's that additional level of protection that's needed, and we can never have enough protection as far as this virus goes.
We've heard anecdotally from other nursing homes that there's some concern about co-administration of vaccines, giving the COVID with either influenza or giving the COVID vaccine with the pneumococcal vaccine. What are your thoughts on that?
Yes, this is a common question that comes up, and I always say never pass up an opportunity to vaccinate. So I encourage co-administration. The CDC says co-administration is safe, and that is based on a lot of evidence. So I would certainly encourage my patients to receive the influenza and the COVID vaccine the same day, or the COVID and the pneumovax. If they're due for a vaccine, I wouldn't want to wait, and not, if they're willing that day, I would not pass up the opportunity. So we have been co-administering, and I have not had any adverse reactions that I can associate with the co-administering.
The next area I would like to discuss with you is the COVID antiviral therapeutics. And I wanted to know what the most common antiviral or COVID antiviral that you prescribe at your facilities, if you're currently using the IV antiviral, and what percentage of your nursing home residents that are active, that have COVID, are receiving the therapeutics?
Yes. So we right now in all of our facilities, the most common therapeutic agent that we're using is the Paxlovid. This is easy to use. It's very safe in the right population. We have an excellent pharmacy team that really goes through their kidney function, their other drugs to look for drug interactions. They are fantastic as far as giving us advice on what medications to hold or what dose to use. So they have made the use of this medication very easy for us, and they give us those recommendations. We do not use IV remdesivir in the facilities. If a patient has that significant of a change in their status, are requiring oxygen, and they're that high risk, they really should be monitored in the hospital setting. And we have not taken that step to have that on hand to be able to administer. So if that patient is, based on their advanced directives and their goals of care, if that's an agent that we think the patient would benefit from, we are sending them out to the hospital setting. We were, up until recently, when the guidelines changed, doing the monoclonal antibody infusions. We had the capability to do that in all of our facilities. And every day for a while, we were giving these infusions, and we saw a dramatic turnaround with symptoms, and we prevented a lot of hospitalizations by using that therapeutic. Recently, the guidelines have changed, and it's not effective against the circulating variants, so we have put that on hold. But if that guidance changes again and the strains change, we would certainly be willing to use that in the facilities again. As far as the percent of our residents that are receiving therapeutics, I would say if a patient has active COVID, meaning they're symptomatic, we looked at our rates and we have 85% of those positive symptomatic patients that receive a COVID therapeutic. If a patient is asymptomatic and they were screened or tested, we are not treating. None of these medications have a significant indication for prophylaxis or asymptomatic treatment. But of active symptomatic cases, 85%. And I would say the 15% that are not receiving a therapeutic agent, that is either based on their, renal function, seeing as Paxlovid is one of our, only options at this point, any significant drug interactions, or sometimes patient choice. We do have patients that choose not to go on these medications.
So what are some of the primary education messages on the bivalent vaccine that you have given to residents and staff and caregivers? Like how have you approached caregivers of some of your residents?
Caregivers, again, it's an individual discussion. So the way we start in the facilities, we do email blasts for education, we have posters, and we offer vaccine clinics every 2 weeks. But all of that is very passive education. I think where you can really make a difference is when you take the time to have the discussion. And that goes for caregivers too, because a lot of our patients, they can't consent for the vaccine, and we have to get the consent from their caregiver. So that goes to having a discussion either in person if they're able to come in, or taking the time for a phone call. And it really does help when the provider calls that family member and has that personal discussion and doesn't leave it up to the nursing unit manager, because that shows the importance and significance. If a provider is taking the time out of their day to call and explain the importance of this, we have found that that goes a long way. On the other hand, the unit managers, the nurses, they have an excellent rapport with some of these families. And sometimes the level of trust from caring for their loved one day to day, they have a more effective way of communicating and kind of convincing that vaccination. So it's using stories about spread in the facilities. I think that has been a key message that I've tried to deliver. Just recently in September, we had a outbreak, and it spreads quick still. It's very, very, very infectious and contagious. So the way that these facilities are set up, with everyone needing, care from nurses and dietary and physical therapy in and out, we do our very best with infection prevention, preventing transmission. But the best way is to prevent the virus from being there at all. And that's the discussion we have with these family members. So it's really, there's no magic easy way. It's taking time, but the time is so important when you see the benefit of preventing these outbreaks. Early on with the primary vaccine series, when we had the New York State mandate and we were encouraging our staff and residents to be vaccinated, we tried to think outside the box. Like, how can we do this? How can we get through specifically to our staff? We knew there was a mandate, but more importantly, we knew the staff would bring this virus into the facilities to the highest risk population. So we knew we had to do something different. The email blasts, the posters, they weren't enough at that point. We created a video, an educational video. We used administration and we used all of the medical directors to give education points and pearls in this video. And I think that personal, like, oh, these are the administrators running the company. These are the doctors that care for the residents. That really was more effective than I thought it would be. It was a very touching video. A professional group actually made it. And I was skeptical that was going to be helpful in the beginning, but it really, really was a nice video and had a lot of good effect on vaccination. We used that video with town hall meetings. So we scheduled town hall meetings where the doctors would be there, administration would be there. We showed the video, but then we opened it up for just an open discussion and forum. And early on, I think where I was able to make the biggest impact on helping staff become vaccinated was the question about fertility and vaccine safety in pregnancy. Our staff, a lot of them are young. They have a lot of childbearing years ahead of them. And some of them are pregnant or trying to conceive and become pregnant. And that was a main fear that I think I personally had the most discussions addressing with our staff members. So luckily, I was also 20 weeks pregnant at the time of this primary vaccine series. So I was able to use my own anecdotal evidence that I chose to be vaccinated to protect the baby, and that this was truly the only way the baby would have any option of immunity when they were born. So really putting it in, and we don't know how this virus is going to change. We don't know if its virulence is going to change. We just don't know. And the only way you can help is to be vaccinated yourself. We used examples of, we don't have a lot of good evidence as far as at that time, as far as if immunity was transferred, but little stories from our office where we would, check for immunity on those finger pokes we used to have. And if a mom had immunity and then we checked the baby at a week, the baby also was showing immunity. So those aren't evidence-based, but those little things did help some of these moms that were fearful really say, okay, I could do this for the baby. Also, we obviously cited the evidence that this was safe, both Pfizer and Moderna, in many large clinical trials, that this was proven to be safe for pregnancy and had no negative implications on fertility. So we cited the evidence, but more importantly, I think when there's that personal touch about those, I chose to do this for my unborn baby, and this is why, I think that really helped. So the town hall meetings were very effective for other questions too. Another way we got through to staff there was to talk about visiting elderly family members or visiting sick family members and trying to make it more personal to them outside of their job in the building. And that really helped too. We have not done any of those with this bivalent vaccine. I think there's a lot of vaccine fatigue, COVID fatigue, and we have not done that. But that may be, now that this has prompted me to look at our vaccination rates and I see how low we are for staff, I do think we need to do better. And I'm also interested to hear how other facilities are encouraging this vaccine for staff.
Along the way, have you had any issues with access to the vaccine or vaccine supplies?
We have not, luckily. That has been one issue that we have not had to face. We use our local pharmacy, Buffalo Pharmacy, as the supplier, and we have had the vaccine in these facilities before our major hospital even was able to administer them to their staff. So access has not been a problem, and so we've been lucky in that regard. We've administered to residents as early as possible, trying to, take into account getting time for consent, but we have not had access issues.
So who administers the majority of the vaccines in the nursing home facilities that you are the medical director for?
The unit managers on each unit, the nursing unit managers, they are our RNs, and they administer for all of the residents on their units. And then we have RNs in employee health in both facilities, and they run vaccine clinics every 2 weeks and vaccinate our staff.
Excellent. So I'm wondering, with your 75% success rate with your residents, what are you thinking about the other 25%?
Thinking we need to do better. I'm thinking that we need to have those individual discussions. We need to take each resident as this is a priority. We need to hone in on that, take the time. I think time is a big issue. These patients are sick, and a lot of times there's, 10 other issues that need to be addressed urgently, and we lose track of how important this is, because once a patient's COVID positive, this may have been the single most important thing we could have done. So I think the awareness that our rate is low at 75, I would consider that low for staff, for residents. I think awareness of that is going to push for us to do better, because I don't think our nursing staff realizes we're only at 75% for residents either. So this is going to give us a nice take-home message to work off of, and to help encourage all of our staff to have those discussions, push the vaccine, have our pharmacists give education. Our pharmacist is wonderful, and she's made a lot of good impact in her discussions with residents and families as well. But I think it's making this a priority again. And I think that when we make it a priority and we put our resources in, we put our time in, I think we can do it, because the evidence is there. We have the backing from the CDC. We have a lot of good safety data. So that we have, it's really not losing track of how important this is and how much the unknown is still out there and how this could change and affect our residents.
Well, thank you so much for sharing your expertise and your story with us today. I really appreciate it, and I think others will learn from your many ideas and thoughts on this topic, because it is difficult.
It's very difficult, and it's getting everyone re-excited about this because of the potential to make a difference. And I think that's what we need to take back to all of our facilities, mine included, that we need to do better and why we need to do better. So I appreciate this discussion and having me, and it was wonderful to get myself re-excited about going back and making a difference.
Thank you very much, Dr. Gugino.